If anybody has the older notes, the way that this has been changed, because last time lumbar was done separately, and then pelvis was done separately, and hip was done separately, and there's a lot of like special tests and examination things that apply to the pelvis and the lumbar that got repeated, so I just put them all together. So what we're going to do is cover the lumbar and the pelvis together, and then go on to the hip, and that's going to be the next 2 weeks. The hip's a smaller part of it, so some of the stuff that we don't cover today for the lumbar and the pelvis, we'll do again next week. So we have this handout. And I didn't change this handout from before, so it's got the lumbar on one side and the hip and the pelvis on the other. So some of this we may be flipping back and forth. And we're going to try doing something a little bit different with the way it's presented. We're going to do this little quick review thing, and then we're going to go right to the special tests, and then we'll go back to the conditions. So we'll go through the special test kind of a quick once over, and then we'll go back into the conditions. So we'll see how that goes. We'll have to go that way. We'll keep doing it that way. Otherwise, we can switch it back around. So is everybody ready for the... Now that the writer's strike is over, I'm going to have the quiz ready for today. Is everybody ready for the quiz? Right? No. There's no quiz. Okay, so...
You'd think with the writer's strike being over, your jokes would be a little better.
Yeah, I know. Hey, they don't pay enough to have writers. That's the problem. There's not enough in the budget to have writers for this class, so what you see is what you get. Sorry. All right, so then basically we're going to follow the same kind of process with all the other areas. Okay, we're going to talk about what are the bones involved, what are the joints, what's the inner tissue, what's the nerve tissue, and then in some cases if there's anything that's vascular that applies, we'll go over that as well. All right, the main thing that we're going to talk about with lumbar talked about this a little bit before in the cervical. Basically in the spine we're talking about the vertebral motor unit. Okay, so that's the motion back and forth in the spine, right? So basically you have the parts, the solid bony parts, and then you have the parts that move in the middle, which is the disc, and then what's this back here? The facet joints. Right? That's not, it's not exactly accurate that they're not really in that plane in the lumbar spine, but we'll talk more about that later. So, and then you divide this into the anterior motor unit and the posterior motor unit. Okay, so in the front we have, what is this here? Vertebral body, right? And then what's this? This. And then what do we have that runs along the front here? Anterior longitudinal ligament. Then if you have anterior, what's going to be up here? Posterior, right? Basically the anterior unit. And what does that leave for the posterior? What's this? Facet joint. Right? And then so there's some ligament joint capsule that goes around the facet. There's the interspinous ligament, the supraspinous ligament, and then there's the ligamentum flavum that goes in between the lamina. It's not so much pronounced in the lumbar spine, it's more pronounced in the cervical spine. All right, so which part of this do you think is going to bear more of the weight in the spine? The front or the back? Right. So 70% of the weight is borne on this front part of the spine. So that leaves how much for the back? And then you can see basically the way that it moves is the disc, again, acts like a shock absorber, right? And then this is kind of more or less the pivot point here, the facet joints. And then you have the muscles in the front and the back that are going to move the joint. Okay, so it's flexing back and forth like this. All right, and then the main primary motion in the lumbar spine is going to be what? flexion extension, right? You're going to have some rotation and lateral flexion, but that's limited by the facets. In the cervical spine, you have the facets that you can move like this, you can rotate a lot. In the lumbar spine, the facets are more up and down like this, so there's not going to be much lateral flexion and non-lateral rotation. It's mostly going to be flexion extension. Of course, yes, sure, there is some lateral flexion and rotation, but the primary thing is going to be flexion extension. And then we'll talk more specifically about the shape and the plane of the facet joints. Now, the way that the facet joints, the plane of them is kind of like this, so that it forms, it's a circular shape, and the center of the rotation is back here at the SPs. Okay, this is in the notes. We're going to go over this more. This is just a quick run through to get an idea of what we're going to be talking about. So you can see that as it rotates, if the center of rotation is here, so when it rotates, it's like this. So the center point's back here at the SPs, and it rotates like this. So what's going to happen at that disc when you rotate your spine? Yeah, it's a shearing force. Okay? So is it good when you go and lift stuff like this? No, not good. So then that's the part where, if anybody's got here, there's a handout up here that you need. Okay, then if you talk about the forces that act on the disc, well, just to back up here, what's the function of the disc? What's that? Yeah, shock absorption. And then it allows motion, and the facets control the motion. What's the two parts of the disc? You might remember this from when we talked about it in the cervical spine. You want to know how? You want to know the names of those? Yes. All right. And because now we're going to get into a little bit more, again, we'll talk about the pathology of what happens in the disc. But you can see there's different forces that act on the disc. Here's just a neutral position, and then here you can have tension, which is stretching out. Like if you hear about people do this decompression therapy or traction, that's what that is. And then compression is just the effect of gravity pressing on the disc. Then you can start talk about different things here. So bending, what kind of force? What's going to apply that? Yeah, lateral flexion or flexion extension, right? And then shear, how do you get that? Yeah, because like I was saying, because of the plane of the facets and the way that the discs move, when you rotate your lumbar spine, the disc is getting sheared like that. And then torsion, that's just going to be twisting and rotation as well. And then you can get combined forces, where if you're talking about bending forward, you're bending the disc. You're talking about rotating, you're shearing it, and then when you lift something, you're getting compression. So all those three strikes and you're out sometimes, right? And then we'll talk about there's different levels of what can happen to the disc. One of the things is that you can just have degeneration of the disc where it just narrows. So then you can have prolapse, you can have herniation, you can have sequestration where you actually have free-floating material of the nucleus that gets into the spinal canal, and we'll get more into that.